People talk about it more and more, how humans are not just physical beings, how they're physical, how they're spiritual, how they're emotional. It's really the same approach I take when I'm assessing a patient's dental needs or the ways that I can try to improve their health. I try to look at physical aspects. Physical aspects are like mercury exposure. There's physically a metal coming out of the filling, it's being deposited in your tissues, it's having a physical effect. We have physical effects from bacteria that are in different jawbone infections and different kinds of teeth. They can physically move out of the tooth, they can physically deposit themselves in other parts of the body and cause problems. Those are physically oriented problems to me. Sometimes we'll also look at electrical or energetic connections. And it's one of the interesting things about the mouth and about teeth. All of our teeth have a nerve inside them. That nerve ultimately leads back and connects to other nerves that connect back to our brain and spinal cord. So our teeth are really hardwired in our body to connect with our nervous system. It's really an interesting fact because we have an electrical system and our nerves work through electricity. The teeth and what happens with the teeth can also make an electrical or energetic impact on your systemic health. My first exposure to this concept was with a book I read by a great doctor, I think, named Thomas Rau. I believe it was called The Swiss Secret. Dr. Rau talked about, he has a clinic someplace in Europe where he treats cancer. And the point I'm making about him in his book was that he found that certain types of systemic illness, in particular breast cancer, seem to have a high connection to root canal therapy. And one of the things that we look at in my practice is this tooth organ meridian chart. There's a copy of this on my website. There's a way for you to go to a mouth on my website to click on the tooth and find out what organ systems and joints that tooth connects with. Because some of the statistics and the research done on this is quite outstanding. Dr. Rau found that over 90% of the patients that he treated with breast cancer had a tooth that was treated with a root canal in the same meridian. The meridian means like the circuit that's running through the body. The two teeth in particular that seem to orient and relate in high statistic to breast cancer are tooth number 3 and tooth number 14. They're not the only teeth in the mouth that associate with the breasts, but it seems like these teeth have a strong impact or an ability to be predictive on breast cancer. There's another great doctor that I go to see lecture all the time named Jerry Tennant. Jerry Tennant has a clinic in Dallas, I believe, Dallas, Texas. Dr. Tennant actually has a story about how his own health was affected by a root canal. And he's a brilliant man. He's been an inventor in the eye industry and all these things, but he was actually bedridden for many years related to an illness that they really couldn't figure out. He ended up finding out that it was related to a root canal he had. And this root canal was having a negative impact through his entire body and through this entire meridian. And it was causing significant health problems that no one could figure out. And from what I understand, talking with Dr. Tennant, it kind of revitalized his medical career, and he does a lot to help people now, looking energetically at the body and how he can improve health through rebalancing energy. Dr. Tennant's an amazing man. He looks at voltage and all kinds of things when he's healing people. So I just wanted to talk about it a little bit because it's one of the ways that we try to support our patients' overall improvements in general health is by looking electrically. For example, there are 4 teeth in the mouth that orient a lot with the heart. They're wisdom teeth. Teeth number 1, 16, 17, and 32, you would notice on this chart, they all go to the right heart, the left heart. Those teeth associate with the heart. There are people who do a type of process called electrodermal screening. One of my favorite clinicians that way is a woman named Dong Ewing. She practices near and with Dr. Bill Glaros in Spring, Texas. Dr. Ewing is a master electrodermal screener. And what that means is that they measure these energy points on your hands and on your feet, and it's a valid science. They can actually measure the energy flowing through this meridian. When you have a root canal, associated or connected to that meridian, they always see a drop in energy. So that's how I think about it. It's like there's not enough energy running through the system for all the structures, all the muscles, joints, to have proper energy to work correctly. So that's one of the ways we improve our patients' health here, is by trying to improve electrical conduction and have healthy energy running through meridians in the way that it supports general health. There was a man, the man that developed the electrodermal screening process, a man by the last name of Vole, felt like a lot of the heart disease and heart problems were related to the extracted third molars. It's real common that what we see when a third molar is extracted, that all the ligament associated with tooth is not cleaned out properly. Maybe the patient's not at a good part of their life for healing. You know, they're under-rested and undernourished and they have a lot of stress. People don't heal great in those environments. Maybe the anesthetic that the dentist used had epinephrine and it constricted blood flow to that area and didn't allow it to heal properly. There's a lot of different reasons why people don't heal properly from surgery. It's not always because the dentist has done anything wrong. Sometimes the dentist can do everything right and the patient doesn't have a good healing system. We see that more and more. Some of the experiences I've had in my office related to this chart have been in the ways of kidneys. I've seen people within a year of having a root canal on a tooth that went to the kidneys develop kidney cancer. I've had patients with lung problems that had a root canal on number 19. Number 19 is a lower first molar and it associates with the lungs and large intestines. We saw her ability to oxygenate her body improve after the root canal was removed. She was able to come off of her oxygen. I saw one of my first cases that I saw was a very nice man from Chicago that was struggling with prostate cancer. He had had all these lower front teeth removed many years before, but there was noticeable infection in the spaces where the roots were of these teeth where they had never healed right. And I didn't know exactly what to expect and hadn't done the procedure a lot, but we really had nothing to lose with him. So we went and cleaned out these areas of infection in his lower jawbone. We saw his prostate cancer improve. I don't ever tell a patient that I can fix a systemic illness. I really don't always know what's causing it. But I do know that dental problems are at the heart of our systemic health problems. Dentistry, because of its microbiology and the way it can pollute the body. Dentistry, because of its electrical connections and the way it associates electrically with the body, really is at a core for a lot of different types of health problems that we see in the body. And again, you can print out a tooth organ meridian chart on our website and you can look. If you know you've had a root canal on tooth number 5, you can look and say, well, tooth number 5 goes to the lungs and large intestines, and tooth number 5 goes to the right shoulder and the elbow and the hand. This is not research-based, but just me paying attention to statistics in my own office. I would say that about 20% of the time when we remove an infection, and that can be a root canal, it can be a cavitation, a place left behind in the bone after a procedure was done many years ago. When we take that infection off that meridian, we see about 20% of the time an improvement in inflammatory body pain at this site. I've seen that with a woman that was struggling with cancer. She had 2 root canals on her lower right, on number 30 and 31, and it had terrible right shoulder pain. And she had had multiple surgeries on her shoulder to try to fix the pain. Nothing had been successful. There's actually a diagnostic process we can do in our office to try to confirm some of these associations. I talked about it a little bit in previous videos on neural therapy, but we use a very special type of anesthetic called Procaine. When we deposit that around a tooth, a little bit on the outside, the inside of a root canal, if we see someone lose body pain at the time we do that injection, then we have a stronger belief that those two things may be related. And I've done that sometimes in my office, and it's a lot of fun. If you have somebody that's got body pain, you do a little bit of an injection around a tooth and their body pain goes away. It kind of makes everyone feel excited that maybe we can get rid of the body pain while we remove a life-threatening infection. There was a scientist from Germany that I saw several years ago named Johann Lechner. His research may help us understand why having root canals and having cavitations can increase our inflammation, our body pain. His research was where he would identify the inflammatory markers in jawbone infections. He found a couple, one was called Rantis, FGF2. These were different types of inflammatory markers. Doctors will look at these things to try to understand the mechanism of action, how things work, how the body is running an illness. It tries to give them an opportunity to intercept these things at a certain part to make a difference. So there's a lot of research that's been done on what inflammatory markers in the body correspond with what illnesses. And what Dr. Lechner's research found was that the levels of Rantis that they would find in these jawbone infections, which is an inflammatory marker that relates to breast cancer, the levels of Rantis in the jawbone infection were thousands of times higher than they could find them in any other fluid or space in the body. And I also keep that research on my website for people to be able to print out and read. But it helps us to understand that sometimes an infection can be giving off inflammatory markers that cause pain to happen at another part of the body, at another body site. I always think about it like when in Texas, when you're driving out in the country and you see a farmer or somebody burning trash. You know, you'll see it from a long ways away. You'll see the smoke coming out of the barrel, and you know that somebody's burning trash or they're burning something. That's what it feels like energetically to me when I think about someone with a root canal or with a cavitation infection. It's emitting a type of pollution that's going into the body. And it's our goal at Transcendental Health to try to make the best positive impact we can on our patients' health by thinking physically, thinking electrically, thinking structurally about the body. It's a little bit more of a traditional approach, but we find great results with it.